We have families coming in from like the smallest of towns and the remotest of villages from all over the country. I think when they first come to large metro cities where we have our centers, they feel that the treatment will be done in a couple of days and they'll go back home. So, for lack of finances, people unfortunately squat outside the hospital on the payments. Families who first walk into a St. Jude center cannot believe what they see. That can be so clean, can be so nice, can be so comfortable. It's a home away from their home. So since 2006, St. Jude has welcomed almost 6,000 children who've come into our centers, undergone their cancer treatment and gone back to their homes up until 2020 when the pandemic began. And like the rest of the world, our lives changed too, absolutely overnight. On the 24th of March, we went absolutely in shock when the lockdown was announced.
As it is, our children are immuno-compromised. In our language, they are battling cancer. But then we realized that we're going to have to be in a warlike situation because not only the kids will be at risk, their families will be at risk. We are responsible for them. We are not only in big cities. Yes, our biggest center is in Mumbai. I don't know what it's going to be like in Vellore. I don't know what Jaipur is going to be. I don't know how Mumbai is going to be. Then at that stage, we realized that we better have a war room to coordinate. Within our team, we had Anil Nair, who's our CEO, Shirley, who's our COO, and Shamika was the executive officer in charge.
We did a lot of planning in the war room. However, without our staff on the ground, none of this could have been executed. When the families were living with us during the pandemic, there was a lot of fear, there was a lot of anxiety given the pandemic, their child's treatment, with their own well-being. One of the factors that made a lot of difference was our staff's presence. Families knew that we were going to be here for them, and that helped us get through our planning and execute it well. Our first priority was to ensure nobody went hungry because of shortage of food. We had anticipated these needs, and throughout the pandemic, we made sure that we had enough supplies for all our families.
यहाँ पे पूरा 165 फैमिली रहती है, मतलब 165 फैमिली रहती है, तो उनके हिसाब से पूरा राशन आता था। तभी हम लोग डबल मास्क, शील्ड पहनते थे और पूरा प्रिकॉशन लेते थे कि हम लोग को भी कुछ प्रॉब्लम ना हो, और पूरा उसको अच्छी तरह से सैनिटाइज करते थे, वो बाहर से पूरा पोंछ के लेते थे।
The war room took a lot of decisions on a day-to-day basis, and one of them was to see how we could reduce the footfalls of the families going to the hospitals. We had Dr. Nirmalya Maulik, who is a part of the pediatric team at Tata Memorial, who visited the campus. We selected a place where he said we could start an OPD, and they manned the OPD, where about 80% of our children were checked on a daily basis, and only the ones needing therapies like chemo or radiation were then asked to go to the hospital. Unfortunately, a 3.5-year-old child tested positive on the 14th of May. That was our first case, and COVID finally entered our centers.
It wasn't that we were not anticipating this. We immediately sprung into action. We stepped up our infection control protocols, and we converted few of our centers into isolation wards. We were also maintaining a tracker and a dashboard with all COVID-specific details, and the details were collected from all our centers across India. The tracker captured data of all positive cases, recovery dates, vaccination status of our staff, families in the centers. As the cases increased in the country, we could see them rising on our tracker as well.
See, when you are away from each other, you don't know what is their need as on today. So what helped us? Sharing our phone number. So they used to give us a call as per their convenience. It was their time, it was their need, it was in their control when to call.
We realized that we also had to enforce certain activities, something to keep them busy. What we did was staff would actually go to the center and without entering the center, provide them with papers and coloring pencils. So all the families were engaged with these.
While we were very worried about where we'd find COVID funding, it actually worked out okay. We went to existing donors who have been supporting us for many, many years, and they realized this is a need, and they were happy to step in. So Morgan Stanley gave us the funding to help us provide nutritional and ration support, because now our families couldn't go out to buy things that they otherwise would have been able to. Amazon, they gave us tablets because we realized that education was entirely online now and children needed tablets to access that online education. Cipla provided transportation for our staff to come into the centers because we didn't want them using public transport. Children that couldn't access our centers because they were in remote parts of the country, they still needed to continue with their treatment, which required them to have oral medication. And Blue Dart made sure that these medicines went to a particular point, and then thanks to last mile delivery through Parley, another donor, we made sure that these medications reached the children that needed them.
St. Jude planned for the Maharashtra families, about 20 of the families, where we send our own vehicles accompanied by our staff to drop the families right up to their doorstep. Because we were aware that along the way, we wouldn't get anything. So we had food, we had dry rations, children had medicines. With all the documentation in place, our bus did 2 long rides in Maharashtra.
The commitment that we make to every family, every child is that once a St. Jude child, always a St. Jude child. In the sense that once we commit to support them during treatment, we say that we'll make sure that we come till you complete treatment, we are there. So if we were in the face of adversity like COVID, we said that, sorry, this is conditional to COVID. I mean, I think we would not have been true to that, our word. In the face of uncertainty, for the staff to come to work and leave their children behind, spend time here, the parents. I think it was a major symbol of courage. None of the employees look at their association with St. Jude as a job. They are here because the children motivate them. None of us knew that whether it would be around on the other side. One of the things that keeps us going, to make a difference to the lives of those 2,000-3,000 families. We know that we are able to make a meaningful impact in these lives. Any child who walks into any of our centers today, I want to assure the child that the last 2 years gave us confidence that we have the resilience to face any kind of adversity. And we are with them, not just for the entire period of treatment, but for the rest of their lives. Once a St. Jude child will always be a St. Jude's child.